physicians and chaplains often don't speak to each other. There's more contact between the nursing staff and chaplains, and that's a really good thing. And yet, insofar as you have chaplains and physicians rounding on the same patients in the same space and not speaking to each other, that's a breakdown in medical care, and it's a breakdown that's felt in the experience of patients and family members who don't feel cared for as whole persons. I would suggest that at the very minimum, spiritual care teams ought to ensure that everyone in a healthcare setting charged with caring for a patient and attending to a patient's needs are in communication with each other about those needs. People who are charged with specific attention to the spiritual, like chaplains, need not only to talk to patients to ensure that patients have their needs met and feel cared for, but also need to be able and willing to talk to other clinicians about what difference that makes in the patient's medical care. When I'm advising or encouraging chaplains and chaplains in training, I encourage them to, in their notes in the medical chart and in their discussions with medical providers, to say things that make a difference, in which their training as a clergy and as spiritual care providers comes to the fore. What difference does it make in a patient's medical care or in the way that things are talked about with family members and patients?